At Danbury Hospital, Jessika Lobraico is bridging the gap between cutting-edge medical research and personalized healthcare. Together with her research team, Jessika is fighting to provide a better future for her patients.
My name is Jessika Lobraico, and we are at Western Connecticut Health Network's Danbury Hospital on the 6th floor in the South Building, which is also the research group. Did you bring lunch today? Yes. In our group, we're considered original research, although I think now we've changed our name to Clinical Outcomes and Health Services Research. I have a master's in genetics, so I'm more bench science-based, basic science-based. I work with residents here at the hospital, so the medical residents. I work with the attending physicians here at the hospital. Sometimes we engage nurses, physician assistants, APRNs, and obviously the patients.
Hi, good afternoon. How are you?
Very well.
Good.
I was definitely a science kid when I was younger. It started when I was watching The Magic School Bus. I'll never forget the episode. It was about the human body and someone ate a sandwich that had mold on it, and ever since then, it must have been like 7 years old, I've been obsessed. So I was always the teacher's pet in my science classes. I was always asking all of the questions. Through high school, I was in all of the science classes. I took all of the APs. I was just really interested, and it just kind of never went away. I've always been interested in science. So my mother is a nurse. She's also in the military. My stepfather is an ER physician. My father is a police officer, so he didn't really follow, that field. But they're all in the service industry. They encourage you to think. My stepdad always had his medical journals lying around and things like that, so I would read those. So they were proud. They were happy that I wasn't, choosing something outside of their field, because then we wouldn't have anything in common, nothing to talk about at the dinner table or anything like that. Coming into work in the morning, I'm typically very happy and excited to come in, mostly because this is one of those jobs, one of those career paths where you don't know what you're going to get, and I enjoy that about this. You have scheduled meetings and things like that, but you never know what studies may come up and be proposed to you. What happens is we do investigator-initiated studies, which means that our residents, our nurses, any of our attendings, they'll have an idea about a research project they choose to pursue or have a question, and we'll help them facilitate it. So we'll help them see their patients, we'll help them design their questions, we'll help them collect the data, analyze the data. We're kind of an all-in-one sort of team here. So where's this patient?
He's currently on
And I'm going to have you jump right up on here. Some days I have patients scheduled, and I'll see the patients that are scheduled. I'll sometimes draw their blood. We'll run other tests on them. And then other days, it's on an on-call basis. You never know what patients you're going to see. You don't know if you're going to be on the floor, if you're going to have to go to the ER to see a patient, if you're going to go to cardiac rehab, if you're going to have to go off-site to see a patient in a primary care office. There's a level of excitement to this job because you don't know what's going to happen. On the contrary, when you go home and you have a day and you were in all 4 of those locations, that's when you feel a little tired at the end of the day. But at the same time, you've reached lives, you've touched people, and they actually feel a sense of importance. So even though they're sick, they may have helped somebody else not be sick in the future. And you see that. Obviously, there are days where it's tiring and things like that because they're longer than you want them to be. But overall, you do have this sense of good. And it's nice. I enjoy it. Like any hospital, the hospital is defined by the people that work inside it. And when you're on the floors, generally speaking, you can tell that the nurses care about their patients, the doctors care about their nurses, but you can tell that with the teamwork environment that people really dedicate what they do to their patients. They understand that we're here for a reason.
Thank you.
And the reason is the patient.
Thank you. Sure.
I do love working here, and it's actually nice because a lot of hospitals don't really have a research culture as part of them, and this hospital has really embraced what we do. And I know that a lot of the doctors are focused on their patients now, but when they interact with us and are willing to do studies with us, I really think that our research is innovation for the patients of tomorrow. And that with their support, we're able to proceed and progress and to be able to treat those patients because we're doing such great things on our end. You go home at night and you feel like you've done something right. For research in general, to be able to instill that trust in patients and in yourself, it's nice.